Thank you for giving us the opportunity to answer your questions. This video is designed for those of you who have been wondering, who are these treatments meant for? But to begin with, are you ready to answer a few questions? Take a good look at yourself. Is there anything you don't like about your hair? Is your hair too thin? Is your hair sparse in areas? Is the area around the forehead bare? Is the top of your scalp the way you'd like it to be? Towards the back of your head, can you already see the scalp? Are family genetic factors involved in your hair loss? Have you been given any anesthesia in the last 6 months? Have you been pregnant in the last 18 months? Are you currently on a reducing diet? Do you have any problems related to the thyroid gland? If you have answered yes to one of these questions, then treatments are meant for you. What kind of treatments are we talking about, you'd like to know? Well, we can't tell you because we don't know the status of your hair roots. What's more, we'd like to prove to you that our treatments will help you. But the only thing we can do is to measure the results of a hair root examination.
Question: what does that mean exactly? Answer: after an initial examination of the roots and a series of treatments lasting 3 to 12 weeks, a hair hygienist then conducts a second examination to determine if the situation is better, stable, or worse. If this examination has been performed properly, the margin of error will be 10%, in essence, 5% higher or lower than the real result. Following this, these results are computed using a special software program that recommends length of treatment and specific products.
Did you know that each hair has a root? Did you know that the name for this root is the hair bulb? Did you know that the quality of hair depends on the quality of hair bulbs? Welcome to this short video on hair root examinations and keeping your hair. We'll begin by showing you a series of bulbs, or roots if you prefer. These bulbs are viewed using a high-powered microscope, which allows you to differentiate the quality of each bulb. The first reaction of people visiting a hair hygienist for the first time is, why do I need a root examination? Let's take a close look at a series of bulbs. That should help make things a little bit clearer. To begin with, we'll look at the healthy bulb. First off, what goes by the name of the hair bulb, or the root, has nothing in common with the plant variety. These bulbs are composed of a tiny type of cell called germ cell, which has nothing to do with germs and bacteria. These cells form clusters and then redivide until forming a hair. Normally, the part of the hair called the bulb is twice as large as the outer portion called a shaft, the part that is cared for and styled by a hairdresser. A transparent film can be seen surrounding the bulb. These are oily substances that lubricate the bulb and prevent it from sticking to the sides of the follicle. Let's take a look at another root, a root that is much smaller than the previous one. If we had made a movie of this process and could rewind it, we would see that the previous hair dropped out at the end of its life cycle, but that the environment it left behind has been changing. The follicle that the new hair grows into is blocked by a buildup of fats, which have formed a seborrheic cocoon, thus preventing the hair from becoming as large as the previous one. This process is what explains why hair becomes finer or wispier as it becomes older. Now, let's take a look at a third bulb. This is a dead bulb. In other words, before dropping out, this bulb takes on a different shape. Whether it's because the end of the growth cycle has occurred or because the follicle has dilated, this hair will fall out and will be replaced by another hair, which oftentimes is finer than the one it replaces. Thus, we have seen 7 different types of bulbs to analyze. On the basis of this classification, we are able to go on to the next step, which are 1. Establish the percentage of healthy or unhealthy hair. 2. Choose an appropriate set of treatments. 3. Assess the results. That is, analyze the difference between the first and second exam and determine whether the situation has improved, remained stable, or become worse. For a hair hygienist, examining hair bulbs is similar to how a doctor or dentist conducts an X-ray examination. What kind of results can I expect from treatments? Let's not forget one thing. While root examinations are essential for the hair hygienist, the results of treatments are the fundamental reason people come in for a consultation. What we're striving for in treatments can be stated in the terms of the following goals. 1. To arrest the loss of hair if that is the main problem. 2. To conduct a series of treatments to thoroughly cleanse the scalp. And 3. To preserve your remaining hair for the rest of your life if the examination shows this hair to be in good condition. And 4. To give hair greater volume if treatment is maintained for a period of 6 months. There is one hitch, however. Something we don't do is to make hair grow back in areas where it's been lost. Ross hair hygienists are seasoned professionals who have been in the business since 1987. Our method of treatment is used in many clinics in the United States and across Canada. You took the first step by coming in to see us. Don't wait any longer. Now take the next step of having your hair roots analyzed. You'll know 4 important things: the current status of your hair, the kind of treatment recommended for you, the length of treatments, and an estimate of the cost. Our guarantee? You will preserve your remaining hair if the checkup examination shows it to be in good condition.